Happy Tuesday of week 2 of Corona Academy. And we're going to talk about our spleen and our thymus right now. So, your spleen is part of your lymphatic system because it contains a ton of white blood cells. And remember, one of the jobs of your lymphatic system was to filter out harmful substances and fight infection. So your spleen kind of tucks behind your stomach, and it actually is almost not really attached, but it's a little bit stuck to your stomach with a membrane. So here is your spleen right here, pulled apart, and here's your spleen there, and the shadow would be the part that's behind your stomach. So when you look at that torso model in my room, if we ever get back there, the spleen can't be seen because the stomach is anterior to it. So if we wanted to ask a test question, we could say the spleen lies blank to the stomach, and you would answer posterior. So our spleen, look at all these blood vessels coming off our aorta that lead to our spleen. So that tells us that there's a lot of blood in our spleen, and it can actually contain a liter of blood. So think about like a box of Pepsi. Half of that's a lot of blood. Half of a 2 liter of Pepsi. Mountain Dew, whatever you want to drink. So lots of blood can be contained in your spleen. Why we store extra stuff in our body is just in case we need it. So if we had really low blood pressure, or maybe we had lost blood, we could our spleen would kind of squeeze the blood into our bloodstream, so we would have the correct blood volume, and we would maintain homeostasis. Remember, that word is your body wanting to keep everything normal or the same. Homeo is same. So that's one of the jobs of our spleen, is to store blood. It also recycles old blood cells. So remember, our blood cells only hang out for about 3 months, 4 months maybe, if they're really good. And at the end, we need to separate the iron and the protein, get rid of all the extra cell parts that we don't really need anymore, and that's your spleen's job, is to recycle old blood cells. It also can destroy damaged blood cells. So one of the reasons why people with sickle cell anemia can have enlarged or damaged spleens is because they have misshapen hemoglobin very frequently, and their spleen works overtime trying to break down those red blood cells that are not shaped correctly. We also have some white pulp. So that's what the red pulp does. The white pulp in the spleen is your white blood cells that filter, and fight infection. They also can make lymphocytes or your white blood cells. You can have your spleen removed. You would not be able to store extra blood, so you may not respond as well as somebody with a spleen in a crisis situation, like low blood pressure or a trauma where there's blood loss. You would also be a little bit more prone to infection. But if your spleen is damaged or ruptured or overworked because of a disease process, then they would have to remove it. All right, that's enough about our spleen. Check the next video for our thymus gland. Happy Tuesday.